Welcome, everyone. We are glad that you joined us today. Sorry about the little bit of a late start. We had a little technology challenge, but we're glad you joined for our question and answer time with media and a time to let the community know what's happening with COVID-19 in the Eau Claire area. Today is Thursday, October 14th. Again, pleased that you're joining us. Gina is online to help support this Q&A session. So she is not sitting with me. So again, I'm able to be in the room not wearing a mask, but she will be online watching the chat box and certainly helping support, making sure that any questions at the end are answered. Enter any questions that the media has in the chat box now or whenever you think of it, and we will get to those at the end. I hope that people have been able to get out and enjoy fall colors. It is hard to believe that we are in the middle of October already. We'll do our usual data updates about a couple of things happening locally, and then we'll get to questions. Our state status update. There are now 1,579,844 negative tests that have been done for COVID-19, an increase of more than 73,000 negative tests that have come in since last week at a statewide level. Positive cases of COVID-19, we now have 162,325 individuals, Wisconsin residents, that have tested positive for COVID-19. So a large group of people in our state that have tested positive, an increase of more than 3,700 since yesterday, which is a new daily record. Not dissimilar to last week, I will be sharing that our numbers are going up in Wisconsin, and we certainly are at a place that is of concern statewide. Of the positive cases of COVID-19, of that 162,000, 8,892 have ever been hospitalized, an increase of 831 individuals since last week, Thursday. And we now are at 1,552 Wisconsin residents that have died related to COVID-19, an increase of 129 individuals since Thursday. Over the past 6 weeks, the average daily deaths have more than tripled. We all need to pause and be concerned about that. I know that there's a lot of community conversation about deaths related to COVID-19. And I want to tell you that, again, anybody that gets COVID-19 and dies related to that disease is being accurately counted in our system. Not dissimilar to someone that has pre-existing conditions and gets hit by a car and dies. Their cause of death is being hit by a car. So I think we all need to remember that this disease is one that is spreading rapidly. It is causing minimal symptoms in many people, but it also is causing people in our state to die, and is something that we need to pay attention to, especially that those deaths are occurring over the course of the summer and early fall, when we typically don't see many people die of respiratory illnesses or illnesses that are primarily related to breathing. The state is at a very high activity level across the state. We've now surpassed 1,000 people that are hospitalized for COVID-19 currently. So 1,017 people are on the state system as being currently hospitalized for COVID-19. In some regions of the state, our ICU beds are at 90% full or more. We have had messages from across the state about having drastic issues with having space in hospitals and having enough healthcare workers to care for people with COVID-19. In our region, we are doing better, and we continue to always encourage people to go to the hospital if you have an emergency issue. We have people in our healthcare systems, in our hospitals to take care of you. Don't delay. Don't not go into the emergency room. But do know that we are seeing at a state level some concerns related to COVID-19. We need to work together to slow that down. We can't afford to have our healthcare systems overwhelmed. The surge in cases has been going on since early September. In September, beginning of September, our daily case count for a 7-day average was around 700 cases a day. 2 weeks later, it doubled. And now our 7-day average is at over 2,900 cases a day per day. So when you average that out, we don't take any one day because each day has some variation up and down. But over the course of 7 days, the average daily case count statewide is over 2,900 people. It's more than quadrupled in 6 weeks. These cases have contributed to those increasing hospitalization numbers. The 7-day positivity rate, the percent of people positive by people tested, one person tested multiple times is counted once as a negative and once as a positive, is at 20%, almost 21%. It's the highest positivity rate since the start of the pandemic. The state announced this week that they opened an alternate care facility, a field hospital in Milwaukee to care for COVID-19 patients. That is a direct result of the fact that our hospitals, especially on the northeast side of the state and the eastern side of the state, are struggling with numbers of people. We've seen an increase of 25%, almost 25% in hospitalizations in this last 7 days. Again, that field site or that field hospital at the State Fair Park in West Allis is to provide care for people recovering from COVID-19 illness, not those that are in the most urgent need of ICU beds. Those are staying in the hospitals, but really the people that still need hospital care but do not need that ICU care are potentially being treated there. There are no patients there today, but it is now open and ready to receive patients. Our region is also working together to consider ways that we would utilize that facility as well as any other facilities in the neighboring state if that was needed. And we'll talk a bit more about that later. Eau Claire update. We are now at 26,463 negative tests that have been done on Eau Claire residents since the start of the pandemic. We now have 2,508 individuals that are Eau Claire County residents that have tested positive for COVID-19, an increase of 244 since we spoke with you last week, Thursday. It's an average of about 37 cases a day. Again, much higher than what the state or at a federal level is considered manageable. We are at that very high activity level. The positivity rate for Eau Claire County is at 8.7% for the last 7 days. Of the individuals that have tested positive, 2,250 have fully recovered. They're out of their isolation period. We are currently working with 258 individuals that are COVID positive and remain isolated in our community. 83 people have ever been hospitalized, 12 since we last reported to you, and 9 individuals have died related to COVID-19, additional individuals since last week, Thursday. So we're now at 9 deaths for Eau Claire County residents. Weekly, we also give you a quick update about Uw Eau Claire. Certainly, our student population is an important part of our community, and initially in September was certainly causing some increases in our numbers. We continue to see cases coming from Uw Eau Claire students and faculty. They account for about 13% of our previous week caseload. We're holding steady at about 30% of all cases since September 1 have been related to Uw Eau Claire. We also weekly share with you the public health investigations that are listed on the state website. The Department of Health Services at the state level is listing 36 active investigations in Eau Claire County. That was updated on the 15th. 11 active long-term care facilities, 12 other settings, which includes a whole variety of businesses, 6 workplaces, 5 educational settings, 2 group settings, and group housing settings, and 0 healthcare facility settings. That is a weekly update, and we will have an update again next week. Our state rating for COVID activity level in Eau Claire County remains at the very high level. All counties in Wisconsin are either very high or high activity level as communities across the state. Weekly, we also share with you our jail testing data. 184 individuals connected to the jail have been tested, 10 positives with 8 individuals that are recovered. Couple of other updates. Our WEDS system, so our Wisconsin Electronic Disease Surveillance System, the system that holds all of the data that we share with you statewide, is going to have some updates and maintenance starting this Friday at 5 o'clock, so tomorrow. That system will get an improvement and a maintenance process that will be run through it for 24 to 48 hours. Those updates will provide us some really strong data that will be helpful as we move forward. So, for example, we've had some struggles with the negative test numbers landing in Eau Claire County quickly, and some of the updates will help move those negative tests results more quickly into our jurisdiction or our county so that can be reported quickly to all of you. The updates are scheduled to go live no later than Monday. This will have some implications for our follow-up over the weekend. We are working with healthcare providers to get case reports, people that are COVID positive, and do the follow-up as much as we can over the weekend, like we always do. But we won't have access to those electronic reports. That is our primary way of finding out about cases. We will work through all the backlog on Monday with a team that's ready to go with that. And healthcare also will be working through a backlog of reporting. So we know that there'll be a little bit of a bump in the road for us over this weekend, and we'll share more with you as we see how that goes at the end of the weekend. We also want to share with you that our one-day Augusta testing event that happened after an increased number of cases there that happened at the end of September. We did a one-time testing event about 2 weeks ago. Last week we didn't have any of those results, but now we do know that 75 people were tested and 8 of those tests came back positive from that testing event. We also want to make sure people know that we have some new testing availability for community testing, that free Wisconsin National Guard supported testing across the region. So in Augusta, starting on Wednesday, yesterday, we had a new community testing site started at the community center that will be there every Wednesday moving forward from 2 p.m. to 7 p.m. Our first day yesterday was a first start at that free testing option, and we expect that to be running and available to community members across the area. We really want to make sure that easy testing is available for all of our population, including those people that live in more rural areas of Eau Claire County. We also continue to have the regional testing site that exists in Eau Claire on the western side of our county on Highway 12. That address is 6697 US Highway 12 West. Mondays, Fridays, and Saturdays, that testing site is available for people as well as a community testing site for everyone free of charge. Please go to our website to look for that. There is also good information on the website related to testing by all of our healthcare facilities, which are doing an amazing job providing healthcare-based testing to residents in this county. And we continue to work with partners on outbreak testing. So when we have a facility or a business that has a large increased number of cases, we also want to have the ability to go quickly to test people so that we don't have rapid spread. So that is also happening in our community. Please go to our COVID-19 eauclaire.org website and look under the tab that is listed as symptoms/testing tab at that website for more information. A reminder to everybody to get their flu shot. I shared with all of you last week that I got mine. It's an important strategy that we all have this time of year, every year, but more importantly this year to protect ourselves against seasonal influenza. Sooner rather than later is better, but please get in and get a flu shot as soon as you are able to. It is one way to make sure that we have less influenza happening, so we can more appropriately and efficiently deal with COVID cases, especially as we need hospital capacity for that. Everyone 6 months and older should get a flu shot. Flu shots are available across the community, your physician's office, the clinics, local pharmacies, all of those places do have flu shots available. The health department will be doing some community flu shot available clinics as well. Previous years, we've done this connected to schools. This year, for all kinds of reasons, because of not wanting to add bodies to school settings, we've come up with some drive-through clinic sites that will be available to people in Eau Claire County. We're hoping that these are used by people that can't get a flu shot elsewhere. But we will have our first drive-through clinic option in Augusta on Saturday, October 24th from 10 until 3 p.m. That will be a community site for influenza vaccination. A link will be available with more information at that COVID-19 Eau Claire website and at the health department website as well. So please look for that. We will have in early November an additional Eau Claire, City of Eau Claire, drive-through clinic for influenza vaccination. The state order on public gatherings that was announced a couple of weeks ago now. On Wednesday, it was announced that a judge in Sawyer County blocked Governor Evers' order limiting the size of indoor gatherings to 25%. That lawsuit was filed by the Tavern League and has resulted in an injunction to not, until it works through the court system, be in place. As a community, we have to care about the issue of occupancy and the number of people that are in our facilities. Certainly in Eau Claire, we had that percent occupancy at 50%, really with the goal to have fewer people in any establishment. And we still encourage people to really pay attention to the number of people present in any establishment. It's a core public health strategy that we really all need to pay attention to. We're counting on individuals, businesses, and other entities across the community to see shared interest in keeping occupancy a bit lower, as hard as that is, to help slow the spread of disease. We know it's hard for all of our different public facilities to be at lower occupancy. We encourage people to find ways to go to businesses and really be patrons of local businesses and support them in ways that don't require you going on site. And we really encourage everybody to pay attention to occupancy limits, despite the state order having an injunction on it currently. The state order requiring face coverings remains in place. A judge in St. Croix County on Monday did deny a temporary injunction to that order. So that order is still in place. The mask mandate is still in order for the state of Wisconsin in those indoor settings that are listed. Again, this is a public health best practice. Even if the order wasn't in place, we should all see shared interest in protecting one another. It helps slow spread of disease, which will help our hospitals, it'll help our businesses, and it'll help our schools. If we can all lean into this simple strategy, it will make an enormous difference. There is a small population of people that aren't able to wear face masks, but really most of us, almost all of us can. So please really think hard and protect one another by making that choice. It is an order, but we should all be doing it anyway. The City Council, Eau Claire City Council, on Tuesday did vote to postpone action on the contagious disease ordinance that was brought forward by the city and is also brought forward in a similar way by the county. The county vote on that ordinance is next week. The City Council postponed the decision about the ordinance until a task force is formed and can bring a recommendation back for discussion by the council. Again, in that recommendation, they really put forward some dates so that there would be community conversation about this. So the health department is charged with bringing forward not only thoughts about how to pull together a group to talk about this, but then also to lead that process and the next steps. This is a significant decision. It does have an impact on our public health order. It does mean that our community, even more importantly, needs to step in and pay attention to what we're doing. The public health order and the enforcement behind it was never the primary tool in the toolbox of the local health department. Like always, our goal is that we work together to find shared interest in making sure we're protecting one another. The disease has not changed because City Council voted to postpone. The public health best practices have not changed because the postponement happened. This health department still has expectations for the community in really making sure that we walk through this pandemic in a way that protects all of us. We'll talk a little bit more about those expectations in a minute, but I really want you to know that the vote did result in enforcement not being an option for those specific entities that may be blatantly choosing not to follow public health recommendations and at the point in time where we had an order requirements, but we all can play a role in what happens next. I ethically will have to continue to say to the community that we need to do these things. I also will be working with City Council, if necessary, to bring direct legislation forward if we get to the point where the disease spread is beyond the 37 or so cases a day right now that is already at a concerning level. Metrics that we usually give to you are also updated on our website. And those are weekly updates around some of those key indicators that we're watching. Our case count over the last 14 days is 471 cases, still very high, but a decrease from mid or late September, where we were at that 500 mark for cases for that 14-day period. We've had 11 new outbreaks in the last 2 weeks, 9 in the last week. That indicator is in red. Our community spread remains in red. We are at 42% of cases that we don't know exactly how they became COVID positive. They don't know where they got the disease from. Our positivity rate remains in the yellow at 8.7%, right around where it was last week. Our public health measures for how quickly we can talk to cases and how quickly we can talk to close contacts remains concerning, but the case measure is in the yellow. We're at 82% of cases are reached in the first 24 hours. And our contacts are 58% of them are reached in that 24-hour period. Doing a bit better, but still concerning. Again, a reminder to everybody that if you are told that you are a close contact to a COVID positive individual, you need to quarantine for 14 days. We need the community to pitch in and do this. It'll help slow the spread of disease. Quarantine means you stay home and you don't go to work, to school, to social activities. You stay home to make sure you're not spreading disease. So back to the order. The ordinance decision by City Council did result in our order now moving to an expectation document that will be published shortly on the website, and we'll have more information on the website about that. But I will share with you that we know it's essential to use all tools in our toolbox. Again, not just an order to make sure that we are slowing the spread of COVID-19. One of the tools has been that local order and the opportunity to enforce if we needed it. We haven't to date used that opportunity, but it was there if we needed it. In the city of Eau Claire now, that is not available to us. This week, our order is changing to a document that will be around public health expectations based on the state statute requirement that I do what is reasonable and necessary to slow the spread of a contagious disease. Our state and community are at a point where we can't let up on the gas pedal, and we need to pay attention. The new document that will be available to you is very similar to the old order. It does walk through those individual things we need to do, those things that need to happen in spaces, public spaces, and private spaces where we are having multiple people getting together. And it speaks to gatherings, both in private settings and in public settings. So there is really no different expectation than we had for the last number of weeks for any of the entities that have been under the order previously. So schools, businesses, all workplaces, government, daycares, childcares, athletic facilities, all of those entities still have the same expectations as we did previously. We also really leaned into the fact that we need to keep our numbers small. So rather than continuing with expectations around 100 people inside and 250 people gathering for any reason, social reason, sport reason, any other reason, we've really lowered that expectation down to 25. That's been the national standard and the state standard when we've gotten to these high activity levels. So please review that. We will get more information out. We'll likely do a media update on Monday just to get that out to everybody so you have it in front of you when it is available on our website. We really, again, are counting as we move into fall and winter that businesses, schools, all of our community partners, and all of us as individuals are doing their part to keep the spread slow, just like we've been doing for the last number of months. So I'll move into the questions that we got from the media in advance. And then if there are any questions in the chat box, I will ask Gina about that. And then finally, at the end, we'll see if anybody wants to unmute and ask any questions. The first was related to the temporary blocking of Governor Evers' order and what that means for Eau Claire. I believe we spoke to that already. But again, our public health expectations remain at 50% capacity for all businesses. If the injunction is lifted from Governor Evers' order, then we would go to that 25% for those entities that were covered under that order. But right now, our public health expectation remains at that 50% occupancy or 50% capacity. We also got a question about whether or not we have a site selected for a field hospital. So I know that there was some reporting that there was a field hospital put together in Chippewa. I believe that may have been an error, but the field hospital that has been put together is in Milwaukee. We are looking at ways across the region to support how do we get people to that field hospital if we need it. It is obviously a distance away. In Incident Command, we have an alternative care site group that has been meeting since June to look at options for alternative care in our community. But we also know that we have good capacity right now, and we are not currently looking at that as an urgent need in this community. Certainly, we have a team of partners to quickly look at that if needed. We also got a question about contact. A media partner was contacted by a mom of a child with special needs who said that the governor's order had exemptions for mask wearing for people that had disabilities, but the local law, quote unquote, wouldn't. We do not have a local law related to mask wearing. All of the public health expectations by the governor's office and by local health departments across the state have clearly said that there are some people, a small percentage of people that are not able to wear a mask, and we need to respect that. And that's no different in Eau Claire than it is across the state. We want everyone that can wear a mask to wear a mask. It takes some getting used to. We know it can be uncomfortable, but most people, even small children, I was at the Altoona Elementary School building a couple of weeks ago, and the young children there that were, without question, walking through the halls spaced apart and really following all of the best practices, quickly learn. And if our young children can do that easily, I think we can, can be a message to all of us that, yeah, it's not sometimes most fun thing to do, but we can do it, and we can do that because we care about one another. Again, those people that can't wear a mask should not be judged, and we need to be clear with everybody about that as well. So, Gina, do we have any questions in the chat box?
We do. We have one question. So asking if you can clarify why you can't enforce the health order now that it has been postponed by the City Council. How is enforcement any different than it was before City Council voted on it?
Mm-hmm. Yeah, thanks for the question. The question is really related to enforcement in the City of Eau Claire. City of Eau Claire attorneys determined that there wasn't a clear mechanism in city code for citations. So while we have authority for enforcement at a state level, the opinion from the Palm decision back in May related to the governor's order did indicate that a local citation authority would be important. And the City of Eau Claire saw that there wasn't a clear citation ability in city ordinance or city code currently. So because the ordinance included that piece of it, and that also was postponed, that portion, the small portion of the ordinance that was under discussion did include the citation responsibilities. Because that was postponed, the City of Eau Claire is seeing, the legal team is seeing that citation currently is not something that is a viable option. We're working with legal on all of our options. Certainly, the state mandates are still enforceable. We do have Board of Health regulation that is adopted by the county that does include some level of citation authority, and we're working through that. Again, citation, though, is really our very last option. And in this community, we're counting on our businesses and our entities across the community to do what is needed because they see that it's in their best interest as well as in the community's best interest to follow the basic public health principles. Any other questions in the chat box?
That's all that I see.
All right. Would anybody like to unmute and ask a question?
Yeah, this is Sarah Seifert from the Leader Telegram. Thanks for taking this question, Lisa. So I was a little confused and hope you could clarify. So my question is, if the City of Eau Claire is the entity that's saying, we're not going to let the health department enforce this yet, does that prevent you guys from doing an order countywide? Why not just say, we're still going to do a countywide order, but the City of Eau Claire can kind of do what it wants to do?
Mm-hmm. Thanks for that question, Sarah. So the question really is what happens city level and county level. Certainly the best responder to that question is our legal team. I will say that it is my understanding that because of home rule and local rule, that a city is considered separate from the county and is in a distinct spot related to enforcement of an order like this. And it's certainly part of what we've been exploring across the last number of months. Again, a county order at this point, my understanding from city legal, would not be enforceable within the City of Eau Claire.
Gotcha. And if you have time, I just have a really quick follow-up question. So, depending on what the City Council decides to do in 2021 here, is there a possibility, depending on what they do, that the health department could put forth another public health order similar to what we see or what we've been seeing?
Yeah. So the question is really what could happen next. There are lots of options moving forward. And again, the team both health department and our community team, looking at, what is best for our community as we step forward is an important part always of our processes locally, including the order that we have had since mid-May. We could put forward subsequent orders and could move forward the ordinance that was being discussed more quickly. Those are definitely options. It is also an option to do what's called direct legislation, which My layman's terms are to say that it is an ordinance or a requirement that some piece of what is going to be best practice for public health happen in the city of Eau Claire and or in Eau Claire County. So some communities, for example, have done a mask ordinance where it goes through as if it's a parking ordinance or a ordinance for some other city level activity. Like we've seen, you can look at the Code of Ordinances for the city of Eau Claire and you see there are ordinances or laws for the city on everything from parking to zoning to open alcohol containers. It would be possible to do an ordinance and have that be considered by city council as another option moving forward in the short term if that was felt to be an important tool that we were missing in how we work on disease spread. I'm really counting, and I've shared with city council that this is a community that cares, and it has not been my strategy to lean into the kind of stick of enforcement, the writing of tickets for $200, which was what the citation authority was. I actually don't think that that's the most effective way to work together to slow disease. It is one tool. And if we decide we need that kind of ordinance with citation authority, we would go to the city council and recommend that. Any other questions that people have? So again, my thanks to everyone. I hope people find some time to enjoy being outside in the fall. It's gotten colder, but I rode my bike very quickly over the lunch hour to run to the farmer's market today. Cold as it was, it's good to be outside. I hope others find a chance to, even if it's for the 15 minutes that I did today, get outside, try and do that. A reminder that our website is regularly updated. We have a lot of new updates now because of this transition to public health expectation document. We'll have a lot of updates happening over the next several days, and we'll make sure that that happens quickly so you can find the most recent information there as well. Again, that's COVID-19eauclaire.org. Do look for that update and the situation report, which is a quick, easy to read document, which should be available on the website sometime tomorrow to get more information about what's happening with COVID-19 in Eau Claire. You can also, if you have further questions, always call our COVID call center number. That number is 715-831-7425. Thanks, and everybody take care.